to distinguish myself from Judy on health care for veterans. I don't like at all the idea of the veterans going to private hospitals, and either do the veterans. I read that that was a new idea, but I basically have heard that idea for 25 years, and there are no veterans organizations in the United States that believe that. Judy, it's kind of like the vouchers with public education. If you start taking money out of the veterans system, eventually it will collapse, and those hospitals, the veterans fear that they'll be privatized. And it's also, those hospitals really aren't equipped to deal with the special needs of the veterans. I think that most veterans have an opportunity to go to clinics throughout the United States, and that the expansion of more clinics is a better idea. I also think that all veterans ought to be allowed to go to veterans hospitals, not just some of them. And you know, it worries me that we would actually take revenues that are currently going to veterans hospitals and send them to private hospitals when they're not really equipped to taking care of them. And don't you think that we ought to support the ideas of the veterans organizations that know best what the needs of the veterans are?
Ms. Baker, we'll give you a chance to respond.
Thank you. Well, perhaps I should make it available for you to read the entire plan, because, you know, sometimes in the media it's not totally covered.
Well, I read your website. Wasn't it on there?
Let's talk about the plan and what the problem is. The problem is that we have Vietnam vets and Korean vets that are aging into the process. Now, I went over to the VA hospital and visited and talked with them just to find out what capacity was like, what we were going to need to do. Right now, there is an incredibly long wait, first of all, for mental health. And you'll see that the mental health services is a big portion of my plan. We have a staggering statistic about PTSD and suicide in our vets from Iraq. And they are unable to get mental health services. When there are mental health services, and this actually demonstrates my expertise in the healthcare field. I know what I'm talking about here. We've got mental health services out there in rural areas that could absorb some of the capacity and mental health services especially are one of those things that needs to be done locally because it's kind of an ongoing thing. If a vet could be able to see a provider in their own hometown, it would be very convenient, and it's not diverting funds at all. We're going to have to build capacity anyway, so why don't we use some current structures to do that, current networks and systems that are already available. If we try and expand capacity in addition to what we already have out there, that will actually cost us more. So the plan is actually designed to potentially save money in the long run. Right now we have vets that are coming from long distances away. The federal government pays that. The gas prices are so high. Sometimes we're spending $150 in the transport of a vet to come and get a flu shot. I've been told this by vets and by the Veterans Clinic Administration, so I think that perhaps maybe I should just give you some more details. We could have.
Well, is your plan the John McCain plan? Because I noticed that he was supporting the same thing where Barack Obama wasn't, but the Disabled American Veterans Auxiliary, the Vote Vets, Vet Voice, Al Gore, John Kerry, all of those people have come out specifically against what you're talking about.
Well, there has been, you know, what I have experienced while I've gone out is the vets are very, very much in favor.
Do you think your experience compares with those organizations?
I have been talking with vets all over the district while I've been proposing this plan. And veterans organizations are, you know, where they say, you know, if it helps the vet, the VA is open to listening to it.